Welcome to the inaugural InvestAugusta Cyber Conference.
Hello everybody, how are you? My dead guy quote is from Benjamin Rush, a founding father of the United States, a physician and social reformer. And he said in 1786, "Unless we put medical freedom into the Constitution, the time will come when medicine will organize itself into an undercover dictatorship." We are about to envision his fear. And our company, Universal Health Coin, wants to change that. So here in the United States, and this Universal Health Coin, as its name, is a universal worldwide solution. But here in the United States, we spend $3.5 trillion, which is 19% of our GDP, on healthcare. $500 billion of that is wasted on administration. $875 billion of that is wasted on duplicated health services, meaning it's a lab here and the same lab is done over here because the doctor and the hospital don't communicate. And we spend billions on preventing hackers from getting access to our personal health information. So we see two problems that we're here to solve today. The first is there's no free market economics in healthcare, especially here in the United States. Because healthcare is so regulated by the federal government, state governments, and heavily controlled by the employers who are providing it and the health insurance companies who are supposedly managing it, there's really no mandate between the patient, who is the would-be consumer, and their doctor who's providing the service. The second is there are too many middlemen, and I mentioned most of them, but it includes payers, brokers, employers, insurers, and government are all middlemen in this scenario, of which are taking dollars away from which we could use otherwise on actually providing health services. So the Universal Health Coin acts as an instantaneous throughput where there's no interference from those middlemen. It's automated, autonomous, and has the cost of administration and security built in to the healthcare dollar. The Universal Health Coin reestablishes the trust between the patient and the doctor, and using our machine learning and artificial intelligence capability, along with the decentralized cash-based system that is built into what we call blockchain and cryptocurrency today, we expect that we should be able to reduce healthcare costs for our members by 45 to 55%. So my name is Dr. Gordon Jones. I have my master's and doctorate in health administration. I've been in healthcare technology since '97, and before that on the health services side. And in that health services side, I dealt with the finance of healthcare. And so what we're really doing is leveraging blockchain and the abilities of cryptocurrency to better finance healthcare and make it a cash-based system that allows an individual to have a business relationship and a clinical relationship with their own healthcare provider. And we facilitate the payment, and we take all the middlemen out of the model. So we're raising $1 million that provides the participant an 80% discount on what's called the initial coin offering. So initial coin offering is very similar to an initial public offering, but it's not a security. But it allows you to participate at a discount as an early participant in our company. So will you join us in the mission to change the financing of healthcare?
Thanks, Gordon. Can you talk a little about your go-to-market strategy? You talked about battling the ecosystem of our healthcare system, which we all love, by the way.
So if anybody's familiar with blockchain and cryptocurrency, it's new. Not a lot of people know about it. So we have a little bit of education to do. But the way that we've designed the system, and you can see the workflow here, well, it looks complicated, but it's not. Basically, I as an individual are going to pay a monthly amount into the system. It's basically a healthcare share program. It's not an insurance product. So I pay into the system. The system facilitates what's called a smart contract, which is a cash-based relationship with the doctor or the hospital for the service. They go see the doctor validates the service, and then the system validates the doctor and the patient visit, and then instantaneously pays that doctor for that visit. And so it's really like it was in the old days where you paid cash, but now we're able to facilitate it and make it more secure.
I mean, I think that leads into my question. Why can't you just pay cash? Why do we need blockchain? Why do we need our own crypto?
Well, because it's more difficult for you to actually go to a doctor and negotiate a cash-based price because they don't have the ability to do it when you walk up to the table. So within our system, using the smart contracts of the blockchain, we're able to have set prices for all the services. And then that smart contract follows you when you go see the healthcare provider. But it's your choice. It's not a network like it is today in health insurance. You can go see your doctor, and they would agree to that smart contract at that time.
It seems that your competition is the status quo. What plans do you have to work with or compete against the payers, the payees, the doctors, the patients, all the people that are doing what you're trying to replace?
Well, so our target market, actually in the medical shared ministry business, there's about 1.5 million people who are already in that because they believe that they don't want government involved in their health care. And this is a way for them to do that without it being an insurance company. So that's our initial target market. And actually, we don't want to replace those share programs. We want those share programs to come onto our platform. Then we go to individuals who have the same mindset, which our target market is millennials at first. And then we go to self-insured employers who want to get out of the insurance business. 80% of the people in the United States are self-insured, covered by their employer. So in other words, when Cigna's your insurance company, they're not really taking the risk. Your employer is. The doctor sends a bill to Cigna. Cigna says, okay, we're going to pay this. They take the money out of your employer's bank account to pay that doctor. So we're going to circumvent all of that, and the self-insured employers will then come onto the system.
Yeah, are you using any specific blockchain technology, or do you?
We'll be built on Ethereum,
Okay.
and use the Ethereum
Are
token.
you using is it going to be a private network, or are you just using?
No,
public Ethereum?
it'll be open.
Okay.
So we want decentralized application providers, which there's about 15 healthcare companies that are using blockchain now. But what they're doing is they're enabling the legacy system to use blockchain. We're going to circumvent all that. But if they want to use our finance system, then they will be able to plug into it.
So the miners will only be the organizations that participate in this. There won't be third party like in Bitcoin.
So there'll be scope of work miners that'll help lift, but it'll be mostly scope of proof or scope of stake, to where a doctor can mine coin by providing healthcare quality, and the individual can mine coin by becoming healthier and following the doctor's orders.
All right, thank you.